Welcome to Bite Size Dental Marketing. Today I have Dr. Thomas Simmons with me. Dr. Simmons, it's such a pleasure to have you. It's been such a great ride. You've been a client of ours for several months, and Ian and you have this really great connection. And Ian's a regular; he loves to jump on the show. I would love to hear a bit about you and what your ideal new patient experience is.
Thank you for allowing me to be here. I appreciate it. A little bit about me. I'm my parents are from the Dallas area. I grew up overseas. My father was in the Air Force. After retirement, we ended up back in the Dallas area. I went to school here, went to SMU and then Baylor College of Dentistry. And then right out of dental school, I took over an existing practice in Plano, Texas. And for the last 19 years, we've had a family practice here, in the heart of Plano. Um, my ideal new patient experience. I think what we bring to the table that is different these days, especially with all the corporate dentistry that is, out there right now, is we try and treat you as an individual, and we want you to have a comfortable, want you to feel like family. So when somebody comes into my office, my ideal experience is that beforehand, somebody's already reached out and welcomed them to the practice and remind them of their appointment. And the day they come in, they're greeted with a warm smile and a greeting, and invited into the office. And I just want it to be a high touch, warm feeling experience from start to finish. I want them to feel comfortable. I want them to come in and have a pleasant experience with their radiographs, their X-rays. I want to have them engage with my assistant and hygienist, and part of the process they get to know you and kind of want get to see what your expectations and dental needs and wants are. And then by the time I come into the room, we already know a bit about you, and I'll sit down, and before I just jump in and grab my mirror and explore, I want to talk to you for a minute or two. I want to kind of see what makes you tick, see what brought you in here, what may be on your mind, get to know you as a person, because I'm trying to build a relationship. I'm not trying to just make the quick buck off you and move on to the next person. I'm hoping you're going to stay here for the next 20 years and bring your kids and your friends in here. And
Mm.
so I want to build that relationship, and then, after we get to know each other a little bit, get your background, look at your, history. I'm going to examine your x-rays, and I'm going to look at, everything, and try and see, the big picture I see from the x-rays, and what might be going on. Ask you, if you have any concerns or any teeth bothering you, see if there's anything I see that's jumping out on your x-rays. And then after I look at your x-rays, I'll lean you back, and we'll look, we'll start from the outside in. We'll do a kind of a bite analysis, see how your teeth are coming together. We'll do a soft tissue and oral cancer exam, make sure that there's, nothing going on that you may not be aware of, because often the dentists and the hygienists are the only people that ever see early stage cancers and precancerous lesions. And then once we've checked the temporomandibular joint, the joint between the upper and lower jaw, make sure that everything seems to be in function, not causing any problems. Then we're going to look at tooth by tooth. We're going to examine your teeth, look for any cavities or any other issues that might be going on. We'll look at your gums, make sure your gums are healthy. My hygienist will do a full 6-point probing on every single tooth in your mouth, checking for any pockets of infection underneath the gum line, or possible bone loss from gum disease that people may not be aware of. And then after looking at all the teeth and checking for cavities and whatnot, I'm going to ask if you had any cosmetic concerns. If there's if potentially you may be a candidate for orthodontics or some other cosmetic. Orthodontics is not a cosmetic procedures, but there should be a comma in there: orthodontics
Hmm.
and
Hmm.
or
Hmm.
cosmetic procedures. And then kind of get an idea of what I see needs to be done, and then we'll talk to you about it, and you tell me what you're comfortable doing, and we'll get a timeline of what works for you. And I don't pretend to x-ray your pocketbook. I'll just tell you what I see, and my ladies at the front are really good at looking at your insurance and giving you a very accurate estimate of what to expect to
Mhm.
pay on your end and what the insurance should pay. And then you will give me a timeline. We just start knocking it out. And, maybe it's a 6 month timeline, maybe it's a 2 or 3 year timeline. But, I just want to have a big picture, what I see. And then, we come together as far as the timing and what you want to do. And then
Yeah.
ideally, you leave having all of your questions answered, feeling like you were part of the process, and you go off and tell all your friends and family what a wonderful experience you had and how unusual it is in the day of all these corporate dental offices.
What do you tell someone who hasn't been to the dentist in many years? What do you tell someone who's dealing with anxiety? And I'm sure you can just sense it when they sit down, but what are you doing? Because shame, people say that fear is the number one reason that people don't go to the dentist. And I think that's a misnomer. I actually think it has to do with shame if you look at the research. And what do you talk to someone about that sits down and you just know they feel shame for not taking care of their teeth, or poor genetics, or whatever the case may be.
Well, I think it's exactly like you touched on. I don't think he meant to shame you like that. I think that sometimes, we're a little misguided in, our intentions. Yeah, the guy had the best of intentions. We
Hmm.
don't
Hmm.
take this career path if we don't, really want to serve people in some capacity. But, not everybody is really good at, communicating really well. And what I've realized over the last, going on 20 years now is that there is a lot of anxiety and shame, that people have already got baked in by the time they come into your office. And, a lot of it, you don't need to tell them that. They've been thinking about it, all the time for a very long time now. And so, I'll often get people apologizing for the state of their mouth, which
Hmm.
I think is just crazy. It's like I'm here to fix it. I'm not here to judge, what got you here. I always tell them, it's like, we're here now. We can't go back and rewind the clock. There's no sense crying over spilled milk. I'm here to tell you what I see and give you the options of making it better. And you just tell me what suits you and the timeline you want to do it. And, I'm not here to judge you. And, that doesn't serve any purpose. I want people to want to come back. That's what we're here for. We're here to help people. And if we, make them feel ashamed about it, then they don't want to come back and they're not getting treatment. And we've just defeated the purpose.
Hmm.
We have to have that trust relationship. And, it's hard to trust somebody that makes you feel like that,
Hmm.
and,
Hmm.
so I'm very mindful to not make somebody feel wrong for the state of their mouth. It's just the state of their mouth, and these are the options.
Hmm. Hmm. Yeah. Now, when you're doing an exam and you're working with the patient and you say, "Hey, I see something here," and I've seen the diagrams, and I do not know the anatomy of a tooth as well as perhaps I should, but I know that there's a stage of decay that it's not hurting, and I know that when through my life, I can remember being at the dentist with my mom saying it's not hurting. I'll just we'll just leave it alone. What is really happening and in there, and how are you talking to patients about this? Because obviously we know that decay continues, and you go from a one surface filling to a root canal pretty quick. What do you talk to patients about through that journey of I see something and they're like, it doesn't hurt, I'm good.
Well, fortunately, we're in an age where technology is on our side in that respect because with the digital X-rays we have now and the intraoral camera photos, I can put it up on the screen and I can show on the screen exactly what I'm seeing on the X-ray or what I'm seeing when I look inside the mouth, and then that gives me a visual representation to be able to describe. Now, unfortunately, like you said, pain is very misleading because some
Hmm.
people just don't have a lot of sensitivity and some people have a lot of sensitivity. So the same cavity on two people might present as pain on one and go completely unnoticed on the other. So that's why going into the dentist office and getting your checkups and cleanings on a regular basis is so important, because if you don't have a lot of sensitivity, you could have a problem go straight from the early phase to an advanced stage before you really have many
Mm,
symptoms. Or sometimes the symptom that you might have is that the tooth got so undermined by the cavity that you broke a piece of it off before you realized it. And so, it's showing them on the X-ray what I'm seeing and explaining it, and then, it's once it's to the point where it merits treatment. Like, sometimes we'll see a kind of a weakening of the enamel, kind of a demineralization of the enamel, and you can see that on the X-ray, but it hasn't penetrated through. Especially if the person isn't cavity strong, we'll say, okay, once you're using some extra fluoride, water picking, flossing, let's keep an eye on this and see if it doesn't progress. If it stays right where it's at, it's perfectly fine. But once it's penetrated through the enamel, the second layer of the tooth is much softer, and it progresses much more rapidly. And so, that's the thing. It's like it may be not hurting you now, but once it gets, deeper, if it penetrates through the second layer of the tooth, and the decay, which is an infection of the tooth, if the decay reaches the middle part of the tooth where the nerve is, once that nerve is infected, that's what necessitates doing a root canal. A root canal is just where we go in there and we remove that infected nerve tissue, organic material on the inside of the tooth, so we don't have something to harbor an infection. Or if the nerve has become irritated, inflamed to the point where it's just painful and it won't settle down, we have to go in there and remove that so that the person isn't in discomfort. And once we clean and shape and remove all the organic material on the inside of the tooth, then we seal it with kind of a rubbery material so that it's not a void on the inside. And then at that point, we put a crown on it. But there's often, if we're seeing you regularly and we're looking at the X-rays, we can catch things long before they get to that level. But it's sometimes it's hard to convince somebody that it's not hurting. It's like, well, that's the best time we want to catch it, is when it's the early stage of not hurting. It's the small fix versus, it's like, these days with the new cars, it's so different because the sensors are so much more sophisticated.
hmm
But I
hmm
still remember the old cars. They used to call the lights that would come on, they would call them the idiot lights, because by the time that light came on,
It
you're
was
out
too
of luck.
late.
It was too late. Your engine is smoking and you're on the side of the road. And so sometimes by the time you get that engine light come on, it's going to be a big overhaul.
Mhm.
And we want to catch it long before then.
Yeah, I mean the irony is that a filling is, I'm going to say, a couple $100. What I mean, a root canal is probably into the 1,500 to 2K range, I'm going to guess, and a crown's probably in the 50. So it might be 3K to replace a full tooth. Pose where a a filling sounds awfully cheap in the early days.
Right. Exactly. I mean, that's what I'm saying. So it's better for me if you put it off until it becomes, more costly. It's better for you if we do the minor treatment
hmm
and it doesn't get that far. But I'm all I can do is educate you, and I'll be here, and whenever somebody's ready, they'll come in. But I want to make sure that they have a grasp of what's going on and the implications for waiting too long. And then at that
hmm
point, it's on them and they get to choose.
Now, one of the things that I didn't understand when I became an adult and started going to the dentist was dental insurance. I When I got into it, I assumed dental insurance was very like my medical insurance. So as this is the office I can go to under these plans, or and once I met my deductible, I had so much coverage, and I don't even like that they call dental insurance. It's some form something different. It's not. I would not call it
Mm.
insurance like your home insurance or insurance like your medical insurance. How do you get past this, 1,500 or 2,400 maximum coverage? Because I know that I would turn down cover. I would turn things down because they weren't covered. Like and now it took me a long time to understand that no insurance company ever had my best health in mind. But today, what are you seeing in sort of the trends, and how are you talking to patients about their coverage or lack thereof?
Well, you're right. I think insurance is an awful term for, dental insurance because it's nothing like medical insurance. And in fact, I don't think it's even evolved much since like the 1970s.
Hmm.
It really hasn't changed. Back in the day, a $1,500 maximum would take care of an awful lot of dentistry. You know, times have changed, and that $1,500 doesn't go nearly as far as you would think. And you're absolutely right that insurance is, it's a contract. The insurance company is in it to make profit, and they're not going to give you one penny more than what is in the black and white of the contract that you signed with them. And in fact, we may be fighting to get them to cover things that they ought to because they have ways of denying things or delaying things and making it difficult, hoping that maybe people won't follow through with their pursuit of it. you know so it's flawed in that aspect. And then the other thing too is they don't care about your well-being.
Hmm.
So you may end up suffering, having a tooth, maybe that is very savable now, but you're waiting until your insurance will give you coverage on it, next year. And you might have that may be the difference between having to take that tooth out and maybe plan an implant versus doing a crown or maybe a crown and a root canal. And so you got to look at the logic of putting off treatment, and letting it become something much worse just to be able to use your insurance. You may be, counterproductive in the long run. The other thing is, financially, you can only do what you can do. And so if you're unable to do it, I get that. But I always tell people if you're financially able to do it now, even if you've gone past your maximum, you still get the negotiated insurance price, which is a significant savings. So it's
Hmm.
not like you're getting the usual and customary fee. You're getting like 40% off of our fees. The insurance is just not paying any of it. It's all you, but you're still getting a discount. And so you're getting the discounted rate. It behooves you to do less treatment than waiting for insurance to pay for it and having to do something that's twice as expensive.
Right, right.
So it's just there's a lot of yeah. I think if we just didn't think of it as like medical insurance, it would help things quite a bit. It's like a discount plan, and they also pay a little bit.
Hmm. Hmm. Yeah, that's well said. It's a discount plan that pays a little bit, right? The irony is, I know that we think of the cleaning being free on the insurance plan, but it's really not, because you're paying $8 or $13 a paycheck or whatever it is. Like
Yeah,
you're just having an installment plan. Nothing's really
correct.
free. Yeah, yeah, interesting. Well, Dr. Simmons, thank you so much for your time. Thomas Simmons, he's off of Coit Road in Plano, an amazing dentist. Going to work with your anxiety, and absolutely phenomenal human being. If you need a dentist, you need to Google him, read his reviews, and go visit. Dr. Simmons, thanks so
Thank you very
much.
much.